Thank you so much for having me here today, and I'm really glad to see some familiar faces, many familiar faces actually in the audience. So before I kick off with this session, very briefly I want to talk about my personal experience and why am I so passionate about women's health. So until I got my son at the age of 35, I was blissfully unaware of what it means to be a mom. I wasn't aware what it awaits me. I wasn't aware of the technology out there that could help me through that journey. My pregnancy was very straightforward and easy, but I ended up having emergency C-section. Everything went well with my son and with myself upon that, but no one told me how hard breastfeeding is. So I ended up having 3 rounds of mastitis, and unfortunately my pain didn't stop there. I self-diagnosed myself with breast abscess at around 45 days upon the birth, and I went to see 4 GPs, including a doctor at A&E, who all didn't want to diagnose me. They were all brushing me off, telling me that it's just a regular infection and that I should take 3rd round of antibiotics to help myself, and it will just go away if I do enough massage of my breasts. So I went to a private doctor, and I went to ultrasound, had the ultrasound, and I was diagnosed with breast abscess. And I literally came 5 minutes before I had sepsis, so I had to drain my abscess. So the whole point here is that if I want you to take anything from today's event, it is that you have to be advocates for yourself. You have to have trust in your own gut feeling, and through that work for yourselves, you can also help other women on their journeys. After that experience, I made it my mission to be the voice and be the platform for other women going through same journeys, or maybe women who want to learn more about what's out there that could help them. So as a community builder of Women of Wearables, which is the leading global organization for women in health tech, wearable tech, and FemTech now, with more than 20,000 members globally, as a journalist for Forbes, where I write about healthcare technology, female innovators and leaders in the space, and investors as well, and through my work as an investor, as the newly launched VC fund, Simpson Ventures, I really made it my mission to help those who might be on the same journey, but also to support incredible women in the industry. So today, it's my pleasure to have 4 of these women with me on a panel, and we have some very, very interesting questions that we will be discussing about, and I'm looking forward to your questions as well. Welcome. So with us today are Ruth Bradbury, Senior NHS Navigator, Eva Lazarova, Clinical Lead at Day, Lina Chan, Founder and CEO of Parla, and Dr. Hiba Sher Khan, obese gynecologist. So let's start with the central role of women in the world of technology. Some of you are entrepreneurs, some of you are scientists, doctors, gynecologists. What were your experiences in this space so far? How do you see a woman's role? And also, what is the role of female founders? Lina can maybe start.
Yeah, so my name is Lina, and I'm the CEO and co-founder of Parla. I think women have a very special role in innovation and helping close the care gap. We bring our experiences to the table, and we really need to be loud with this voice and try to really kind of push change. And it starts with us. And we all have that responsibility. In healthcare, in tech, we all can play a role.
Amazing. Lina, can you briefly just tell us as well about what Parla does?
Yeah. So I think there is a common theme amongst a lot of female founders, is that we tend to start businesses when we ourselves experience something and then get very angry at it not working out. So I also was blissfully unaware of anything fertility related, and then I started trying to have children when I was around 35. I had a stillbirth, and then I had multiple miscarriages, and then really struggled to conceive. It was actually under Leslie Regan's multiple miscarriage clinic that I then went on to have 3 healthy babies. But it was during that time, which took about 4 years, that my confidence was destroyed. I was physically in pieces, I was emotionally in pieces, and it was an extremely vulnerable time. And I had to basically go around trying to advocate for myself, and that shouldn't be the experience that most women go through. It shouldn't be how you feel about your periods, fertility, pregnancy loss, or even the menopause. So I looked to technology to say, well, is there a way for us to really think about technology to really reduce the barriers for women to get access to support cost-wise, accessibility, just being able to do it at home, and just being really kind of wide and everywhere in the world. So I started Parla, initially focusing on fertility and pregnancy loss, but now we've recently added periods and menopause. We have about 17,000 women on our platform across 80 countries, which is really kind of a testament that it is a need and technology can help fill that gap.
Amazing. Ruth, what would you say? Please do introduce yourself.
Thank you. So I'm Ruth Bradbury. I work with DigitalHealth.London. We are a program that supports innovators introduce their digital technologies into the NHS and supporting their spread and adoption. So I think there's a really interesting way of looking at different technologies, that there are some obviously that are very focused on FemTech and really wanting to support women's health issues. But I think as well it's looking at other platforms that maybe collect data and support a better understanding of women's health needs as well. So on our program, we are really focused on being able to support those innovators to understand their customers, their users, to be able to be asking the right questions of the people using that technology. Interesting, in the previous panel, sort of really getting to grips and really understanding the people who have those difficulties that they're trying to tackle. So that's our role, is to really help those products, that technology to fulfill or to answer the problem that they see ahead of them.
Very much needed, for sure. Eva, welcome. Tell us a bit about yourself and your role as clinical lead at DAY.
Thank you. So my name is Eva. I'm a clinical and regulatory lead at DAY, the female-led startup, R&D startup that is trying to bridge the gender gap in medical and scientific innovation. So what I do basically in the company is I'm in charge of the clinical trials that we do with women, and also doing the technical documentation for our products. We are trying to give the menstrual tampon a new lease on life. So basically we have redesigned it to get better absorbency and also sustainability profile, but we're also trying to take it further. So we're clinically validating it to be a device for administering cannabinoids that are clinically proven to have pain-relieving effect on the female physiology, but also we want to use the same tampon in order to get at-home diagnostics and make the screening for women a better experience, and like more easy and more convenient, and just try to get it something to make it more regular, kind of. And from my experience, I feel like, as Lina said, our company basically started because our founder had a very painful period. So she was very angered that there are no, period pain is something that a lot of women go through, but there is no specialized treatment for that, and even the pain relieving drugs that are on the market have not been really tested on women. And that, when I heard her story, that's actually what made me join the company as well, because as a scientist, by education, I've had read a lot of research and papers, but I never really thought about the gender bias that is done in innovation. And what we do at DAY is we try to make it all about the women. So that's why we want to, all our products are they're made for women and they're clinically tested on women. So we only use women as our I don't want to say subjects, but still, we want to try the products for them and test it on them, just because
there's a massive data gap, right?
Yeah, there is a massive data gap, yeah. And women were only allowed to participate in clinical trials only in 1993. And even a lot of medications that are supposed to be for them, there is even the female Viagra. It wasn't tested on women. The data was based on a trial tested on men. So, which, I mean, it sounds absurd, but sadly it's true. So that's why we're trying to bridge that with DAY.
Amazing. Hiba, please tell us a bit about yourself.
Hello everyone, I'm Hiba. I'm an Obs and Gynae registrar in London. Outside of practicing clinically, I have a background in digital and tech. So I lead innovation at my NHS Trust as a Deputy CCIO, and I work at NHS England as a clinical advisor and obstetric lead for the National Digital Maternity Programme, where I can confirm the political chaos has also filtered through. I work with a handful of startups, more recently, specifically those that are working in the women's health space, because I'm frustrated. As a clinician who sees women all the time, I recognize that there is only so much I can do. And I need technology and I need innovation. I need apps, platforms, devices to be able to support the women that I see better, to be able to direct them to the right places for more information, like we've talked about, to places which are going to capture data so that we're able to do good evidence-based and valuable research so that we can make things better for them. And also for clinicians, for services to improve the efficiency and ultimately the patient outcomes that we deliver.
We'll stay with Hiba. Let's talk a bit about innovation and technology and the role it plays in our lives, but also in the healthcare system. And how can it complement traditional healthcare services? Because very often there's a massive gap between traditional and more agile startups, innovative startups. What can we do there? And also, how can workplaces integrate innovation and technology for their employees to better complement what they're already offering?
Sure. I see technology as an enabler, right? The idea is that using technology, we can put information in people's hands. I love a clinic where I see women who come to me with questions because they've read about things, they understand the basics, they've gone away and read maybe the RCOG guidelines or patient information. And so actually we can take that consultation further. I want to be in a position where I can say, a woman that I've discharged postpartum, I want to be able to send her to a particular virtual clinic because what she doesn't always need a doctor. What she needs is a lactation consultant. She needs, perinatal mental health support. She needs, child support, a midwife. And I want, technology allows us to do that. It doesn't replace, of course, but there are opportunities in gynecology for us to start picking up symptoms earlier, using AI to be able to triage women, to direct them to the right point of care at the right time. Not the archaic system that we have right now of, see the GP and here's a referral. You're thrown into this pool, who knows when you'll get seen, and everyone's kind of at the same stage. But actually, I want a system which starts to stratify and separate those women and triage them appropriately. So there are ways in which technology can get rid of the archaic system of seeing the doctor, being told what to do, and we'll see in 6 months, and there be it.
And sometimes it's very basic, right? Like sometimes, we don't need a very high-tech piece of technology to be used. Sometimes it can be very basic, like digital reminders, emails from your GP. For some women, that's already enough. What was your experience on that topic, Ruth?
Well, I was going to pick up on what you said there. I think it's about the infrastructure that we have around IT and kind of thinking about technology. So have we got the basics in place, like digital systems to be able to record that patient journey, to be able to communicate with our patients?
Not to explain your symptoms every single time, all over again.
Exactly. So have we got that infrastructure in place? And then we can start to build on the additional layers of technology, the apps that might support symptom monitoring, or that might support kind of information to sort of understand your condition, or that then might help to improve that diagnosis, as you said, around AI, etc., etc. So I think it's building from the ground up, and everybody understanding what those different parts of the journey can offer. I think that's. And the other thing I was going to say was around, I guess, exclusion, because when we think about digital, we're leading very digital lives, whether that's through our banking, through our social lives, but there are a lot of people who don't access digital in the same way. So in terms of sort of digital complementing traditional healthcare, we have to be in a position where we can offer the two. So for those who can't access that because they don't have the ability maybe they don't have a device or they don't have the understanding, how can they access more traditional kind of face-to-face patient-clinician kind of services? So it's about that whole rounded offer.
Absolutely, because only then healthcare will be inclusive, because it has to be accessible to everyone, right? Question for everyone. there are obviously limitations within the world of technology, right? Technology is not a magic wand that we can use and then magically solve all our problems. But how can we actually ensure that all women have the access to technology, no matter how basic or high tech it is? Lina, shall we start with you?
I think I don't think it's necessarily technology. I think one thing that has really crippled women's health, and I've definitely seen in the last couple of years, is that women doesn't have the voice to advocate for themselves, because a lot of the times symptoms that they're actually struggling with, they don't know that it's something that they're struggling with. So from period pain, irregular cycles, miscarriage. I mean, women don't know about miscarriage until the day that they're going through it. So a lot of access happens earlier than technology, is actually changing that conversation, making that conversation a lot more mainstream, making that conversation a lot more available for women. And technology then can enable that a lot more, because through forums, through TikTok, through apps, that's how we can start getting the two things together. You can't really make a massive change in women's health if you actually don't help women engage with their health differently than we do now. There's just so much shame and so much taboo in it. So those things need to work in parallel. You need to start building the awareness. You need to start changing the conversation, and then having all the support system going under that. So from NHS to improving women's health in the workplace, or reproductive health in the workplace, to the apps. It's really a system. It can't just be one thing holding it all together.
Absolutely. Eva, what would you say?
Well, I just wanted to add that, like, basically bringing from the last panel as well, education at school, that's something that has to be brought to in order to raise awareness and make sure that this information is accessible to all women and they're aware of, like, what's going to happen. And also, like, nowadays we live in the era of social media, so it's really, really easy to like reach out to all the women there, and not only women, like males as well, to like actually be aware of what's happening in the female body throughout the years.
Absolutely. Yeah. There's no excuse for my husband not understanding what's happening when I'm PMSing. Absolutely. Would you also say that technology has progressed over the past few years? I can still remember that when we did at Women of Wearables our first FemTech event back in 2017, half of the people didn't even know what FemTech is. People were asking me, oh, is it a FinTech event? And I was like, no, FemTech, women's health, come and join us and you'll see what we'll be talking about. And I know that a couple of years later than that, Lina also spoke at one of our events that we did. And the situation has changed, you know, there's more awareness, there's more media awareness, women are more aware, more investors are investing in women's health technology innovation or consumer products. So things have changed, but we still have a long way to go. Hiba, what would you say?
I would say, to your point, that people are investing, they're still not investing enough in
Absolutely.
FemTech, not nearly enough as they should be, because women's health has totally different needs, and we can't model women's health around a white female body. There are lots of kind of different avenues to explore there. You said also about kind of improving access. I think we have to democratize it in a way that we have to bring it, in a healthcare system. I think we have to start providing these opportunities for women to access education at different touch points, at every single touch point, whether you're your GP, your healthcare visitor, you're getting a blood pressure check, whatever it may be. But also we need to bring it to the high street. If I can order Deliveroo, why is there no place that I can go on and access contraception straight away because I need it now? Why is it that the morning after pill is easier? And I know we're making progress now. The progesterone pill is making its way onto the high street. But it is still difficult to access these, straightforward services. If you need to access, a sexual health clinic, there isn't one way that is as easy as us, the way that we do food delivery or banking online, to be able to access healthcare. And I think, so again, technology is an enabler there. It doesn't replace the fact that you need to see a professional or talk to one, but we have to be able to stratify, who needs to be seen in a healthcare setting and who can actually just have a remote conversation and a distant engagement to be able to send them to the right way and get them the right care and treatment that they need.
Absolutely. And if I may add, we have to see technology as an enabler to alleviating symptoms and burden to the healthcare system, because if we progress with this tempo, NHS or any other healthcare system in the world, modern one, won't be able to cope with the demand, right? Because the situation has changed and needs have changed.
I mean, I think if there was one great thing that fell out of COVID was it really helped people get a lot more comfortable with digital health. I mean, you know, GPs were online, we're doing consultations on WhatsApp. So I think there was always kind of this divide between FemTech technology and traditional medicine. And that was one great thing that came out of COVID, I think, was an appreciation on both sides of how technology could bridge that. And I think it's very much that we need to bring those conversations, we need to use these platforms to bring those conversations and those services closer to women and meet them where they're going, right? I mean, if we're having issues where women don't even feel comfortable going into the GP, so where is it that you're going to be connecting with her to make sure that she's getting the support that she needs?
What are some ethical and legal challenges in this space?
Trust. I think trust is one that's very, very important. I mean, having gone through a personal journey of this, my first port of call was always Dr. Google, which is awful because you don't know what you can trust and what you cannot trust. So I think all of us as women and companies building in women's health, I've always think that we have a responsibility to put things out there that has been vetted, that is science-based, even if it means it doesn't sell a ton. Women need to come to us because they really trust that what we're putting out there is effective. So things like clinical trials, co-creation sessions with patients, those are things that are very important in building into product innovation. So when we developed all our programs, we actually got 2 grants from the Wellcome Trust to do exactly that, was to look at finding a way to do a digital-first approach to women's health, but actually involve women in designing the product. So I think that is something that's very important, that we make sure we stay true to selling things that are effective.
I would absolutely agree. I think one of the areas that's really central to the work we do at DigitalHealth.London is thinking about evidence generation. Yeah. And you know, what is the evidence behind this product, this digital technology? How is it improving you know, the services then that are offered to women? How is it saving money? And I think then when we're thinking about you know, that scaling across healthcare, that's such an important part of it, because we're asking organisations, NHS organisations, for example, to take out something traditional and put in something new. So we really need to know that the evidence, you know, behind that technology is that it works and that it's going to be cost effective. So certainly really key to what we do.
100%. Eva, what would you say?
Well, I also agree with it, and that's what we do at Day as well. We are constantly, like when we are developing a new product, we always rely on scientific research. Like we do a lot of literature reviews. We're constantly advising with our clinical and scientific advisory boards just to make sure that we're on the right path and we're not selling something just for the sake of revenues. We actually want to produce something that is going to be valuable and it's going to be effective into treating whatever we want to treat, or like basically just to provide women with the service that is working, not just to like get their money. Yeah, for better experience. Yeah.
Even the simple things like tampons.
Yeah, exactly.
You know, something that needed a bit of disruption, I would say, for sure.
Yeah, and because we, as I said, we want to do a lot of things with that tampon. We want to repurpose its life. That's why we are committed to conducting all those clinical trials just to validate that what we're like claiming that we do with this product is actually true and is beneficial. So I do agree that it's really important to build that trust and ensure that you're providing an effective product to the women, to the female community.
Above everything. Hiba, what would you say?
Would you agree? Just going back to the trust thing, I mean, the way that forget the interactions that they have with healthcare professionals, but the thing that the apps are now doing is they're starting to introduce this uncertainty about where is my data going, who's looking at it, what's happening with it. So there, I guess, lies the responsibility of the people who are, you know, Digital Health Accelerator and things that I do at NHS England, where we have to have a very strict and robust system of how we're analysing all of this and what we're, you know, what kind of data is going to come out of it. Is it going to be anonymized? Because there are pros and cons, right? That data is also really valuable. If we can find ways to make it work and extrapolate all of that, then there's so much that we can do to better the services. But it's still early days. There are lots of apps, like Flow have come out and said that it's all anonymized now and everything. But I'm surprised that they haven't turned around already with the amount of data that they have and gone, well, we can now start to pick up if you've got signs of endometriosis, for example. Like, there are opportunities for us to start using that effectively, and I think once we close that circle is how we win that trust. If I can turn around and say, from all of this data I've got that you've logged for me as a clinician and I've seen, this is what it's pointing, and it's leading to a diagnosis of X, Y, and Z, then that's when they're going to engage with us and be like, actually, there is some value. All this stuff I keep going and repeating is something is coming out of it.
Absolutely. We have 5 more minutes before we have to finish, so we could take some questions from the audience if anyone has a question. Otherwise, I have some juicy questions, but we do have, of course, questions. Lady in the back, raise your hand first. Yep.
A really interesting panel. Thank you very much. Introducing apps. So us women, we're part of this sandwich generation. We're carers, we're looking after our children, but we're also looking after our more elderly parents. Attending appointments is often difficult in the NHS, and I think we are really the adopters for apps because we're doing it when we're breastfeeding in the middle of the night, etc., etc. As a consultant gynecologist, also with working in digital health, it's incredibly challenging sometimes to introduce apps that are CE marked, classified as a medical device, CQC regulated, comply with all data. And I guess my question to the panel is, how can you make it, for those of us that are innovating in the space, trying to introduce new products, how do you encourage that? I work at the Whittington, I can't communicate to UCH because we have a different computer system. You could probably combat that through digital health devices. And I just wonder how NHS England could incorporate that specifically for women's health, which I think there's even a greater need. We adopted a diabetic app in obstetrics. It took us a year to get it through procurement. I just don't think it's good enough, really, and we need to be moving a little bit quicker. But I'd love to hear your comments on that.
Thank you. Maybe we'll...
Yeah, so I can answer maybe some of that as well, and I'm sure the panel will join in. I think, there's a lot of work going on at national levels and sort of then more regionally at our ICS levels now as well, to really make sure that that clinical journey and that clinical record for patients is joined up. The challenge that innovators have who've created their app and it passes through all of that regulatory compliance is they have that challenge of integrating more often than not. And they're real barriers. And at this moment in time, there's no kind of real getting around that. It takes time and it takes money and it is quite difficult. But it is possible. And I think what then is necessary is that there are the champions like yourself who are, you're in those roles to champion those opportunities with innovation, that you are then able to network across your own organisation so that you can find the people who will make that happen, the IT people, the IG people, thinking about who's in procurement that you can get on board to really take that through, and working with your innovator as well. So, what can they bring to this journey? Have they got that evidence to hand to be able to plug into a business case, for example? How can you access any external funding that might push this through quicker, different grants or other pots of money that might come up at various points during the year? So I don't think there's one person who drives that. I think it's a collaboration of everybody coming together at different points and different levels of the system.
There was one more question. Yeah, thank you.
Thank you. I think it's really interesting, and as somebody who's been through 2 rounds of fertility treatment in the last year, over which I provided all of my own data on an app that I've been storing it on, and I've got, the guys at Wellbeing of Women know, because I'm a fundraiser for them and I share quite a lot of my story on Instagram. I've basically tracked everything for my practitioner, but I've still been charged the same amount, and I've still been charged for interactions that have been digital, £195 a consultation. Sometimes it's a 6 or 7 minute consultation online. And I think the area for me is, if we are going to utilise more digital apps, which I'm a huge advocate of, we need to try and reduce the cost burden then on the patient somehow, because I'm almost doing the job for them in providing that data to them. And I don't know what your thoughts are on how we can move that forward in the future. I've spent over £12,000 now in the last year on treatment. of which a lot of it is on consultation fees that I've done digitally or I've provided the information myself. So I'd be really keen to know what your thoughts are on that.
Fertility treatment's really complicated because there's only so much that obviously is funded by the NHS, and we know that there's already disparities within CCGs of how that is. I think what we're trying to do is to push the needle to say, well, actually, there are so many things that we can provide within an NHS setting, such as the consultations, maybe not the treatment, that will provide support and guidance, because it's not complicated to have a 6-minute conversation, and we should be able to factor that in and recognize that this affects lots of women, and there's no one size fits all, like you've had one go, now you're out on your own. We should be able to integrate that, and I don't have an answer to how we fix that, but it's something that we can all start advocating for and pushing the agenda on. And just to go back to the question that happened earlier, I mean, there are 2 prongs to kind of trying to bring in innovation for patients and for clinicians for it to work. I mean, we, on a trust side, we run a digital den, and that's down to individual kind of local champions to set that up. And so we do that every fortnight. Anyone in the hospital, any patient, any kind of volunteer, anyone who's associated to our trust can come and bring an idea and say, this is what I want, or they can say, this is a problem that I have. And it is our job to go and explore different digital options. I'll be honest, not everything goes through. We have to have a very strict process. We have to get a business case put together. But at least by bringing the relevant people, we bring those stakeholders together every fortnight so that they're all in the same room, whether we're discussing one thing or 5 things, so that we're having this regular conversation. So it's part of our ethos to say, we need to keep analyzing what we're doing. We need to keep bringing in the right technology. From a national perspective, we can't mandate what trust takes what technology and what app that they take. But what we can do is my job is to help and support national frameworks to say, this is the bare minimum that needs to be there for the women. So if we're working on a maternity, an app that we want to put in everyone's hands, what we can say is, this is, as a clinician, with all the patients that we come together with, we co-design a criteria and say this is what it needs, because every individual system and area has different needs. So they are then free to go and procure what works best for them in their services. And the thing that we need to crack, and we haven't done in the healthcare system in the UK, is that interoperability for everything to start speaking. And once it starts speaking to each other and that data flows, that's when the floodgates will open. We'll be able to achieve so much more. But I'm optimistic, but we'll get there.
That's really great. And we are finishing on a very positive note. Thank you so much to our amazing speakers. And we would love to connect with you during the networking, so please do connect with us and on social media as well. And we have run out of time. We have one more session. That's it. Thank you so much.